I was doing is I was just kind of making sure I was evaluating to see if you were having like any radicular symptoms or radiculopathy into the hands, fingers, or anything like that. All signs point no. There's nothing going on in terms of radiculopathy or numbness or tingling going down to that area. Does that mean that it won't happen or it won't develop? Probably doesn't mean that. Like, it just means that right now at this point in time, you're not having any of those symptoms that go down and into the arm from either the brachial cords being pinched, from the neck being pinched, and I did push on the neck and the head and stuff like that, and of course go through some general range of motion for you. That's great news because I was trying to push it. One of those symptoms that we were talking about, coughing or sneezing, that can indicate compression into the spine. And when we're talking about compression, we're typically talking about, let's get rid of the nerves real quick. We're talking about like disc compression.
Okay.
And so when a muscle or a group of muscles go into those types of protective mechanisms or spasms and become extraordinarily tight, they tend to protect these discs and stuff like that. So it could be from rows and like maybe your head position, stuff like that. What came first, the chicken or egg? Or it could be what we call acute torticollis, which is a fancy way of just saying you got a really stiff neck. It could be from pinching of the capsule. I noticed that you're not really having the same symptoms as acute torticollis that you normally see. Usually you'll see people like with a tilted neck like this, and they'll stay like this for a few days, like you said. It'll be really hard to do a lot of the symptoms. You'll have a lot of the symptoms that you said that you're having, where like the pinching will be like this, but you won't have that full range of motion the way, I wouldn't say that you're having full range of motion. They wouldn't have that. You would be like really severely stuck and locked. Okay. That's what acute torticollis is. That typically, I don't want to say self-resolves, it typically does resolve, and then when you get treatment with chiropractic soft tissue work, you tend to accelerate that recovery a lot faster. Usually that can linger around for about a month. I would say 3 weeks to a month. Most people get better in like 2 weeks, but then they'll still feel like I'm at 90% and I just a little bit pinching. That's where the treatment really helps. But that's not what you're having, so we don't have to really harp on that. I think you're just having some compression and maybe just a little bit of a neck strain into your neck and upper back, and getting that worked out is just going to help decompress not only the spine naturally, but of course we do adjustments here and things like that. So I'm normally, with some people, I will spend a little bit more time educating you about the functions and the anatomy of the disc. I could do that. One, you probably know a good amount of this stuff. Two, even if you don't know this, it's not really affecting your condition, so there's no point in talking about something that's really not 100% relevant to you. With this type of stuff, because there is some potential compression, which is why coughing and sneezing occurs, it's also like that violent movement. Jerking. So it's like, is it the violent movement that's creating it, or is it the compression? I would say a little bit of compression, because I did push down on your head and you felt, you're like, I feel it. And that was when your head was in a neutral position. So I do think there is some compression going down into the spine. This stuff can self-resolve as well. Again, treatment will help it. But I don't think it's really a serious issue where it's compressing a nerve root or anything like this at this point in time. There could be inflammation that can cause some irritation. As you know, that when you have a disc bulge or a disc herniation, you can have direct compression onto that nerve. I'm just going to say it right there. Obviously, it's on the back end, but you can have direct compression to that nerve root. Or what you can do is you can have irritation or inflammation that can create nerve root irritation. In either case, you're not having it. So this is a good, easy, straightforward problem to have. Not most comfortable for anybody, for you, but it seems, if I had to like diagnose it right off the spot, I would just say you're having more of a neck strain at this point in time, sprain strain if you want to call it, with maybe some compression added. But there's no discopathy or disc issues. There's no neurologic conditions that I'm noticing, and you're active and healthy, so it's like I'm not really that concerned and until anything else develops. Okay. If at all, hopefully. Any questions on this at all? Comments, concerns?
Not at all.
Perfect.
Yeah, you explained it pretty well.
So what I'll do is